See, here canine is there. So when we are arranging teeth, we have to keep the scale like this part of canine. This part of canine. This is with the anterior. This will come with posterior. This curve. So this part of canine we have to put scale, and it should come in same plane. In same line it will come. Okay. Towards the ridge. We cannot keep like this and we are saying in same line it is coming. Towards the ridge. Towards the ridge like this we have to keep, and here only all the teeth will come. Posterior teeth. This shows this coming along with this part. Apart from that, all these posterior teeth, if you are confused which is maxilla and mandible, you have to see maxillary premolars cusps are sharp, okay, prominent, and mandibular premolar cusps are rounded and small. Maxillary molars are small, mandibular molars are big. Maxillary first molar will have fifth cusp. Mandibular molar will not have that. Okay, you have to be careful. Also, apart from that, mesial and distal, you have to be careful which side you are using, because first time maybe this is arranged like this, but again and again when you are using, it might be right and left you are confused with. So make sure when this is the midline, okay. So whenever you are arranging the teeth, the side which is towards the midline is mesial. Away from midline, the other side is distal. So mesial side won't be that much rounded. It will be little bit this round, like this. Like for example, this area, this will be little bit like this. But the distal side, like here I'll show you. Like for example, you see this incisors and all, and this canine. Like this is little bit, but this is little above and this is more rounded. Okay. So distal side will be more rounded. You have to understand which is mesial and distal. Make sure when you are arranging, that time when you are keeping it back or whenever you are arranging, that time only you be sure and you arrange. Don't get confused with it. Okay? You don't have to put this over the cast and do. Never. When you are melting, it should be in your hand. It shouldn't be on the cast and you are melting. Don't melt the wax completely, soften it so that how much we require to soft. If extra we have reduced, we have to add wax in that case. If we have softened, extra will automatically come. If extra we have removed, then we have to add. So just soften it and place it. This should be straight. So this should be straight. Okay. This should be in this, so it will come little inside. See the canine, this half is with the anterior, this half is with the posterior. So when I arrange the posterior part, it should come in this line. Then glass plate. I will give in your hand one by one. You can see. When seeing glass plate, the buccal cusp will touch, the distal cusp won't touch. I'll show you after. Give one by one in your hand to see. I will tell first. From buccal side, when we see this is straight. From here, this shouldn't be going down or this equally this should be on same level. Okay. When we check the glass plate, buccal cusp, two cusp we have, this and this. So this side is buccal, this side is palatal. So this buccal cusp will touch, this palatal cusp won't touch for first premolar. So this buccal cusp is touching. This palatal cusp is not touching. See, straight wise I will keep to the same level. I will check with this. For second premolar, both the cusp will touch. Glass plate relation all clearly in the last I will show. This is the first time, so at once you might not understand everything. Not to worry, when you will do slowly you will get the idea. See what I am seeing, this is straight, okay. Glass plate relation, buccal cusp will touch. For second premolar, both the cusp will touch, buccal and palatal. If it is not touching, with this from posteriorly we can just place this and pull it downward. Okay, I'm talking about premolars. Buccally when I see. So when I see this is straight. Both the premolars. Okay. Then when I see like this, and I put scale, from here, this part of canine which is rotating toward, the first half of canine is with anterior, second half is rotating towards posterior. So there when I put scale, it should be towards in the one line, okay? Not in the one line like this, where it is rotating in that one line towards the ridge, okay? It will come over the ridge automatically if you follow this line, this scale line, okay? Then we have to check for glass plate. For first premolar, glass plate, buccal cusp will touch. Palatal cusp won't touch. As you can see here, this palatal cusp is not touching from inside. This is palatal. This will not touch. This will touch. For second premolar, both the cusps will touch. Both the cusps are touching the glass plate from here and from here. So if you see carefully, this is touching. Here I can pass the instrument for first premolar palatal cusp. It is not touching. Here this is not touching, this is touching. For first molar relation is very important. What happens? This is the occlusal plane. The occlusal part of first molar. This is buccal side. This is palatal side. This is mesial side. This is distal side. So buccal and mesial. Mesio-buccal. Disto-buccal. Mesio-palatal. Disto-palatal. So in this, when we see in the glass plate, it will go like this. Like here it is shown. Like this it will go. Okay? This won't be straight. This will be slightly tilted. And in this way it will go. In this way. Okay? One curve it will form. Apart from that, mesio-palatal cusp. This will only touch. If we see from here, from buccally when we see, the palatal, both the cusp we can see. Buccal cusp will be little above. Even though we are seeing buccally, buccal cusp will be little above. and palatal like this. When we are seeing buccally, buccal cusp is little above, palatal cusp is more prominent. Okay, in that also mesiopalatal cusp will touch, distopalatal cusp will be 0.5 mm above. Okay, so here this is slightly tilted. Okay, then palatal cusp is not prominent for now. How we will make it that prominent, I'll show you. This tip I will put, and I will bring that cusp down so that it touches. I'll seal and show you the relation. It is not very prominent that it will be too much above, too much prominent. Very slight, 0.5 mm difference only it will be there. So see, when we see buccally, molar angulation won't be straight like premolar angulation is straight. Okay, this won't be straight, this will be tilted towards mesial side. Okay, then from buccally when we see, the buccal cusp will be little above. Palatal cusp, from buccally when we see palatal cusp, we can see 0.5 mm it will be more prominent than buccal. Buccal will be little ahead. Okay. Apart from that, mesiopalatal cusp will be touching the glass plate, and the distal both the cusp won't be touching. Like you see, distal cusps are more prominent. Buccal cusps are little above. In that also, mesiopalatal cusp is touching the glass plate. If we see from behind, I'll show you again later also. See from behind, this mesiopalatal cusp is touching the glass plate, this cusp. Molars again straight, but this molar, first molar towards mesial side, like this it will be tilted. Okay, first molar relation only is very important. Towards mesial it will be tilted. When we see like this, palatal both the cusp we can see it through, and the buccal will be little ahead above. Okay, then when we check for the glass plate, mesio distal won't touch the glass plate, but mesiopalatal will be touching the glass plate. Okay, further will be same as first molar, but the mesiopalatal will be more prominent than distopalatal, but it will not touch the glass plate. Same, but it will not touch the glass plate. Same relation, little ahead, entire thing. like this is in same plane, so this cusp I want to raise it. Only this cusp will be little ahead, but it will not touch the glass plate, it will be little above. So this part you have to just put here and raise it like this and check. Okay, I will seal this, remove the entire relation. Now it is very clear. So what you are doing now, buccally, what you are seeing, what should be the glass plate, which cusp where, that you have to write in short and you have to draw the diagram. So first you make columns during exam and you write, you draw the diagrams or you write whatever you feel. But diagrams are very important. Even if you don't have sufficient time and you are just writing, you make sure you have drawn the diagrams, that we get the idea what you have understood. Please don't sit like that in class. Buccally, both the premolars will be straight. So when I am seeing buccally, both the premolars are straight. Okay. Glass plate relation, first premolar buccal cusp will touch, palatal will not touch. Second premolar, both the cusp will touch. Like you see from here behind, this cusp is not touching. I can put the instrument's small part over here. This part is not touching. Here this cusp is touching for second premolar palatal cusp. This much is understood? Then when we are arranging, we have to make this in one line. Okay? From here. So automatically it will come over the ridge. So if it comes over the ridge, then only it is proper. It should not go buccally or palatally. So it will automatically come over the ridge. If we pass this line over here, this is coming over the ridge. Okay, this we have to see. Now coming to first molar. First molar will be slightly tilted towards the mesial side. Like here in diagram it is shown, mesial side. The second molar slightly, not much. Okay. Then from buccally, when we see this cusp, even though it is buccal, but we can see palatal cusps also, you see. Okay. Like for premolar this is straight, for second premolar this is straight, for first molar this is slightly tilted towards mesial, this is slightly like this. Because palatal cusp for first premolar is not touching, we cannot see from here. But when we are seeing like this palatal cusp is prominent, this is touching the glass plate. Likewise for first and second molar, buccal cusp is little bit above and the palatal cusp is more prominent. In palatal also, mesiopalatal will touch the glass plate. This will be same like first molar, but nothing will touch the glass plate. like showing the relation on the glass plate. This very carefully we can see mesiopalatal is touching. Second molar is same but nothing is touching. Palatally if we see this, nothing is touching. Here this palate is touching. Here mesio, see distopalatal is not touching. From here we see. So this is what for maxillary posterior you have to do.